Hello and welcome to the Human K channel. Today, we'll talk about defensive mechanisms, which are psychological techniques that people adopt to deal with a variety of difficult situations. Early 19th century medical phenomenologists saw symptoms as proof of sickness, blurring the line between pathology and adaptation. Pathophysiologists in the late 19th century learned to interpret these symptoms as signs of the body's healthy attempts to cope with physical or viral shocks. Defense mechanisms, also known as automatic coping mechanisms, result in abnormal behaviors that reflect the brain's homeostatic effort to adapt to rapid changes in its internal and external environment. Defenses can affect our view of subjects, objects, ideas, and feelings, as well as reduce unresolved conflict with significant others. They serve as a diagnostic template for comprehending distress and guide clinical therapy for psychology's most unreasonable patients. Freud's study of neurology and physiology resulted in the definition of defense as unconscious, distinct, dynamic, reversible, adaptable, and creative. He popularized the idea of sublimations, which may transform conflicting emotions into culture and virtue. Freud's work has impeded our understanding of more advanced ego-defensive mechanisms, which indicate a higher level of mental complexity than more concrete defenses such as projection or turning against the self. Defenses are synthesis mechanisms that serve to explain the irrationality of both sinners and saints. They are difficult to characterize since there is no obvious distinction between character and defense, behavior and mental mechanisms, and neuropathology and unconscious coping mechanisms. Identifying defenses is difficult because objective observers must correlate previous truths with current behavior and subjective reports. The adult development study at Harvard looked at the adaptiveness of defenses in 3 cohorts and discovered that mature defenses were more effective. To assess psychological functioning, the Health Sickness Rating Scale, HSRS, and the Global Assessment Scale, GAS, were established. If a patient's defenses are breached, physicians must obtain their permission before proceeding and provide alternate protections. To better understand these mechanisms, we will look at a case study of a woman who had a hysterectomy after a cervical biopsy revealed malignancy. Let's look at the many defense mechanisms displayed by this woman and explore their diagnostic implications. Mature defenses, level 7, are thought to be more adaptive and productive. They assist people in coping with reality and maintaining good relationships. These defenses frequently require confronting and managing uncomfortable emotions and conflicts consciously. Here are some examples of mature defenses. Altruism. Following her operation, the woman created a group of ladies who had experienced similar surgeries to counsel and visit people undergoing gynecological surgery. This behavior demonstrates generosity, as she focused her emotional energy on assisting others. It illustrates her capacity to find meaning and purpose in helping those who have encountered similar difficulties. Suppression. Despite the fact that she was in pain, the woman covered her tears and made no objections when her sutures were removed. She also purposefully gave away a childcare magazine to avoid disturbing herself. This indicates suppression, as she consciously suppressed her emotional responses in order to manage the issue calmly. Sublimation. The woman enjoyed receiving "get well" cards from her sister's children and participating in activities like teaching a Sunday school class. She also had a poem published that described the bittersweet joys of being a maiden aunt. Sublimation was evident in her behaviors, as she funneled her emotions into creative and socially acceptable channels. Anticipation. The woman's easygoing and practical approach to her postoperative course shocked her doctor. Although she had earlier voiced concern about complications and anguish over her inability to bear children, she now conveyed remorse in a calm and forthright manner. Her capacity to anticipate and prepare for probable difficulties is on display here. Despite her circumstances, the woman found amusement in a Playboy definition of hysterectomy and shared her secret amusement with a nurse. This suggests that she is using comedy as a defensive strategy to cope with the irony of her situation. Level 6 neurotic defenses are more widespread and are connected with mild to moderate psychological suffering. They provide some anxiety relief, but they may also lead to emotional issues. Neurotic defenses include the following. The woman demonstrated reaction formation by strongly fighting with her younger companions about limiting their families. She also expressed relief at not having to go through childbirth. This defense strategy involves adopting attitudes or behaviors that are diametrically opposed to one's genuine feelings in order to reduce worry. Isolation, intellectualization, excessive reading about uterine cancer, numerous queries about the operation, and attention to minute details of postoperative care all indicate intellectualization. The woman attempts to detach herself from the emotional components of her position by focusing on facts and information. Repression. The woman couldn't recall the name of her operation, referring to it as a little nubbin in my tum-tum. She also forgot her first follow-up appointment with the doctor. These memory gaps, as well as the subsequent emotional outburst while smashing a flower vase, are symptoms of suppressed emotions and memories. Displacement. The woman became obsessed with planting tulips and daffodils in her hospital window. While avoiding direct inquiries about her own hospitalization, she sought guidance from her surgeon on the growth on her bulbs on multiple occasions. This action implies that her worries and concerns have been transferred to the topic of gardening. Immature defenses, level 2 to 5, are distinguished by more basic coping strategies that are less successful in resolving emotional problems. These barriers frequently entail reality distortions and can stymie personal progress and successful relationships. Immature defenses include the following. Projection. By writing long, furious letters to the newspapers and threatening to sue for negligence, the woman projected her rage and blame onto the hospital. She avoided confronting her own emotions by attributing her own sentiments and wants to external circumstances. Dissociation. After the procedure, the woman described her suffering as a joyful camaraderie with other sufferers, demonstrating dissociation. This defense mechanism entails disconnecting from reality and seeking refuge in alternate experiences or ideas. Fantasy. The woman instructed the nurse not to allow visitors, threw away her flowers, and spent her time reading parenting magazines and looking at family photographs. She fantasized about naming the kids in the nursery, demonstrating her preference for fiction over confronting her actual feelings. Hypochondria. The woman was overly concerned about the likelihood of cancer spreading to her lymph nodes and went on and on about the lumps in her crotch and neck. She also accused her sister of prioritizing her own children over her own well-being. These behaviors are consistent with hypochondria, as she exaggerated her worries and sought reassurance. Passive aggression. The woman demonstrated passive aggression by smiling at the intern who missed her vein during an IV insertion and then allowing the IV to run dry. Her cheery answer to the intern about not bothering the busy medical personnel reveals her passive-aggressive traits even more. Acting out. After leaving the hospital, the woman committed many acts of infidelity with other people, demonstrating impulsive and risky behavior. This behavior is typical of a sociopathic attitude, as she disregards societal standards and the repercussions of her conduct. Level 1 psychotic defenses are accompanied by substantial disruptions in perception, mental processes, and reality testing. They are frequently encountered by people suffering from psychotic illnesses. These defenses include substantial distortions of reality and can result in serious functional impairment. Psychotic defenses include the following. Despite their financial constraints, the woman declared herself a Christian Scientist on the third postoperative day and planned a trip to Bermuda. This false projection and denial of reality point to a manic mental state. Delusional projection. The woman thought the hospital personnel were attempting to sterilize her and attempted to contact the FBI to report the hospital for genocide. She also refused pain medication, stating it was an experimental substance for mind control. These delusions and paranoia are common in paranoid schizophrenia. Psychotic denial. The woman insisted on being transferred to the maternity ward, searched for her baby, and had baby goods delivered to her home. She displayed characteristics of madness as well as utter disbelief in reality. Defenses can prevent impulse, social learning, other people, reality, conscious acknowledgement of the subject, object of a dispute, awareness of the idea, or the affect linked with the idea from occurring. All types of defenses are successful at denying conflict and reducing stress, but they differ substantially in terms of the mental diagnoses attributed to their users and the long-term biopsychosocial adaptation effects. Level 1 involves denial and distortion of external reality, while levels 2 to 5 are more common in teenagers, immature adults, and people with personality problems. Axis 1 anxiety disorders and everyday psychopathology are connected with level 7 defenses, but phobias, compulsions, obsessions, somatizations, and amnesias are frequently encountered clinically by intermediate defenses. Level 7 adaptive defenses continue to distort and modify sentiments, conscience, relationships, and reality, but they do so elegantly and adaptably. This case study gives us a full summary of the many defense strategies employed by individuals in reaction to tough conditions. Understanding these pathways allows us to gain insight into how people cope with stressful emotions and manage their psychological well-being. It is critical to note that defense mechanisms exist on a continuum, and their presence or absence might help in the diagnosis of certain psychological illnesses. Thank you for your time, and I invite you to learn more about the interesting world of defense mechanisms.